and helping spread the word about this incident that we're dealing with. It's my pleasure to welcome our Executive Director, Tracy Gruber, that's TracyGruber, who will give some brief opening remarks, and then she'll turn the time over to Dr. Nolan.
Good afternoon, everyone. Tracy Gruber, Executive Director at the Utah Department of Health and Human Services. Thank you so much for joining us today as we announce the first measles case in Utah. I want to emphasize that our department had anticipated this given the increases in cases nationwide. We were prepared for this and are just here to answer some questions and provide some information to the public. I'm joined by our Executive Medical Director, Dr. Stacy Bank, and the state epidemiologist, Dr. Alicia Nolan, and we are here, and Dr. Nolan primarily is here to answer any of your questions. Dr. Nolan.
Thank you so much. I can quickly just say to make sure everybody's aware, so we have identified one individual in Utah County who is an adult who has been diagnosed with measles. That person is doing well and has happily been isolating at home and has very limited contacts with other individuals. However, we do have a few places that individual went before they realized they had measles, and we have put those on our website to inform people of the time and the place that they could have been exposed. But with that, I am happy to take questions and answer give you any additional information.
When was the last time we had a measles case before this?
We had a measles case about 2 years ago in an international traveler.
Do you expect there's more measles cases, not just the one?
We do have to suspect there are additional measles cases in Utah. This individual who we just identified who has measles had not traveled outside of Utah. So that means they were exposed somewhere in Utah from someone who was here. We have not been able to identify how that happened. So certainly there is some person who was able to transmit the virus to this individual. So we do think there are additional cases. At this time, we have not identified others though.
You know that the person was unvaccinated. Can you speak to the vaccine and what that can do if people are vaccinated?
Yeah, certainly vaccine is the best protection we have against measles. The measles vaccine is exceptionally good. 2 doses of it make you 97% sure that you will not get the infection. And even if you do get the infection after that vaccine, it's going to be much more mild than if you don't. So it's a safe vaccine. It's a vaccine most of us have gotten. In fact, over 90% of Utahns have gotten the measles vaccine. It's something I got as a child. Most of us got as children. It is a safe vaccine. It's been around for years, and it's a great way to prevent the spread of measles and make sure we're all safe.
And do you have any indication that Utah's vaccination rates have been falling, given some public pushback or skepticism about vaccines generally, or this one in particular?
Yeah. So unfortunately, we have seen a decrease in the vaccine in our little kids in Utah. The numbers are still not super low, but they're low enough to cause us to be concerned that there could be kids who are vulnerable to this. And certainly there are parts of our state or schools that have higher numbers of kids that are not vaccinated. So we are concerned that little kids are susceptible to this. There could be an outbreak in a school. So we really would like to encourage people to get them and their children vaccinated.
When has that been happening in the last, couple months or years? Or can you identify the timeline of when that started to fall?
Yeah. So we have seen a distinct downward trend in the last 5 years of the vaccine uptake in our little kids. But it's been a long trend where there's been a slow decrease. Certainly, we want to work to encourage people and reassure people about the safety of these vaccines.
Are you concerned now just seeing the case pop up here in Utah?
Certainly I'm concerned. We don't want anybody in Utah to get sick with a disease that we can prevent. But I also want to reassure people, most of us are protected. This is an excellent vaccine. More than 90% of our state has been vaccinated. So most Utahns are safe and are protected. But I do think it's useful and important that we recognize the risk to other people and that we act on that.
And just with these exposure times and places that this person had gone to, will someone in the vicinity, could they contract it, or kind of what are the ways that they might get it, or what symptoms would they see today and kind of know that something is wrong?
Yeah, so measles is one of the most infectious diseases we know of. We can put somebody into a room, they just walk into a room and they infect almost everyone in that room. So a classroom, you can just have a child come in and almost all the children will get measles. So it is exceptionally infectious. It is spread by airborne, so it's just somebody breathing. And in fact, it stays in a room for up to 2 hours. So those numbers we gave you in terms of when this person was in these locations, it includes 2 hours after they left, because we know even after that person leaves the room, it is possible for someone else to get infected later. I think you had another part of your question. I don't remember.
Just about the symptoms.
Oh, the symptoms, yes. So the symptoms of measles, usually it takes about 7 days to start to see symptoms after you've been exposed. The people who get sick will have first actually something pretty general. They start with a fever, a cough, a runny nose, red eyes. But it usually goes on for about 4 days, and then the rash comes out. And the rash is really what hints us that this is measles. It's a rash that usually starts at people's hairline and goes down across their body. So it is something that it takes a few days to progress, and it can take up to 3 weeks from being exposed to actually start to have the symptoms, but usually it's about 10 days.
So, I mean, given that it's a week after, now, so someone kind of having a fever now or seeing these symptoms now, should they be on the look for a rash, or what can they do now?
So certainly it is the right timing that somebody exposed because of this individual could start to have symptoms. I do want to reiterate, people who are vaccinated are very unlikely to get this infection. So we are mostly concerned about symptoms in people who are unvaccinated. So it is something, it would be someone who has a fever, and it's not just a mild fever. Usually it's quite high. And they also have at least one of the other symptoms. So a cough, the runny nose, the red eyes.
Can you tell us more about the patient, their age range maybe, and if there are other places that you might identify?
Yeah, so this person is between 20 and 40 years old and is an adult in Utah County. The Utah County Health Department has done extensive talks with this person, with the person's family. We know there are a number of family members who've been exposed, and they've been told to watch out for symptoms, what to do if they do get symptoms. And we've also asked them to stay at home so they don't accidentally spread the infection to other people, because unfortunately this is an infection that you can spread before you're clearly sick. So we want them to stay home just so they can't spread it to other people. Other than that, we were able to talk to the individual quite extensively about all the places they'd been in the 4 days before the rash to the 4 days after, which is when you're most infectious. And that's what we put out publicly, is those locations.
So had that person gone, to the ER, to the hospital because they weren't feeling any symptoms, and is that kind of what triggered all of that?
So yeah, they did go seek medical care because of the symptoms, yes.
And at that point, it wasn't known that they had measles?
So they were advised to stay home and away from other people. So the clinicians who saw this individual did have it on their suspicion. They actually did test for measles. That's what we finally got the result back for, and it was able to confirm based on those results.
Any other messages you want to share with the public at this point? Let's kind of move ahead from here.
I think it's important to recognize that this is a controllable outbreak. We can take control. People can take control of their lives by making sure they're vaccinated and protected, and their kids are vaccinated and protected. But it's also not a minor infection. I think a lot of people hear a cough, a rash, a fever. That's really common in little kids, right? But unfortunately, measles does cause really severe disease. So 1 in 20 kids will go into the hospital, and that's really significant. I think none of us want any kids in the hospital. We also know kids can die of this. We've already had 3 deaths in the United States. We don't want any more. So we'd really like to protect everybody that we can.
Check their vaccination status. I mean, it's in the release too.
Yeah. So certainly if you're younger, we have a really great system here in Utah where you can look on it online. I would most recommend that you talk with your doctor. Many people we know are older, their vaccines maybe were at different clinics. So try to work with your clinician to see if you can track down what vaccines you've had. For people who are really unsure and they aren't certain that they got the vaccines, many of us know we got them. I know I got all my childhood vaccines. My mother would have never let me not. You can definitely get an antibody test. So that means the doctor would take some blood from you and they could see whether or not you have evidence that you are protected against the measles virus.
Is there any advantage or disadvantage to, if you're not sure, getting the vaccine, and should you not get it again?
No, there's no danger to have an additional shot. So if somebody is not able to go out and find the records, they aren't able to do something to get their blood drawn, it is reasonable to get another dose if they think it's unlikely they had it.
And one last question for me, and that is there any difference in the effectiveness of the vaccine based on whether you have a weak or good immune system?
So I'm sure there are differences in how people respond to a vaccine. We all respond differently to everything in our life, right? So I think we all know you have a sibling who barely had the flu and you are in the bed for a week and a half, right? Everybody's body responds slightly different to either an infection, an injury, but also vaccines. So there are going to be some people who are stronger responders and less responders. And that's where we know there are some people that when we say 97% of people are protected because of the vaccine, we know there's some people who just don't get a great response, but it's the vast majority that do have a good response.
If you've already had it and getting another one, does that add protection or is that really negligible?
Yeah. So the recommendation is everybody should have 2 doses. We know that 1 dose is 93% protective. We get 1 more dose, we get up to 97. So we just bump it up a little bit. Most people will get that when they're little. It's recommended when you're 1 year old and then when you're 4 to 6 years old. So certainly that's recommended for our little kids. If an adult has not had 2 doses, it's definitely reasonable to go and get a 2nd dose to make sure you're fully protected.
Thanks. Cool. All right.
Thank you.
Thanks, Misha. Thank you, Dr. Nolan, and thank you everyone for participating with us today. And thank you for all your help in getting these safety messages out.